Good afternoon, everyone. This is Maureen Dobbins, the Director of Health Evidence, and I'm really excited to have the opportunity to spend the next hour and a bit with you going over searchinghealthevidence.org. First, I'd like to wish everyone a Happy New Year and hope that everyone had a wonderful holiday season and that the weather isn't being too unfriendly to you out there on the East Coast. So I'm just going to go through again, for those of you that may have joined just at the last moment, a little bit of the housekeeping. So the way we conduct our webinars, we've learned from the past that it's really not conducive to having people actually, speak verbally. And so if you have any questions, we'd really like you to post those to the Q&A portion that you see at the bottom, and then everyone will be able to see those questions, and then I will do my best to answer those in the latter half of the webinar. Certainly, if you have any issues as we go, for example, if you can't hear, there could be connection issues. We do recommend you use a wired internet connection versus a wireless. And Heather, who has been giving you a few tips along the way getting set up for today, if there's a few things she can help problem solve, she'll respond in that Q&A. And if not, we recommend using the WebEx 24/7 helpline and the number is provided there. So I'm really just delighted that you want to learn more about how to search health evidence. We would have talked about this a little bit at the workshop that we did back in May, and I'm already, it's just surprising that it's now already January, and it's almost a year since we were out visiting with you, but really excited that you want to learn more, and we're going to go through just giving you some helpful tips on how to really get the most out of health evidence today. And really, this has all been made possible by the Health Evidence team, and in particular, I really want to thank Heather Husson for all of her work in preparing the presentation for today and in connecting with the team in Newfoundland to help really tailor the workshop for today, the webinar. So as we would have discussed also back in May is, what we're really trying to help support both at the National Collaborating Center for Methods and Tools and Health Evidence is evidence-informed decision-making. And the specific piece that health evidence really brings to that process of evidence-informed decision-making is really making it easier for you to access the evidence, the research evidence on the effectiveness of public health interventions. And this model hopefully isn't new to any of you. This is really the model that guides all of the work that we do here at Health Evidence as well as the National Collaborating Center. And really this model just depicts this complex decision-making process that takes into account many types of information. We know that, of course, it's very, very important to consider the community and political preferences and actions, and those are things that you would be gathering data on a regular basis in terms of understanding what the needs of your community are and what the political scene is in terms of what is part of practice, what isn't, what's really happening. And in addition, what health evidence is really focusing on is that research evidence oval, which is how can we best make it more easily accessible to find that evidence of what works in public health. We know from those very large health databases, PubMed for example, that the public health content in those large databases is very, very small. It's really like looking for a needle in a haystack when you're trying to find systematic reviews of the effectiveness of public health. So it can be really challenging, and we know that that is a significant barrier to accessing the evidence, and hence why we developed healthevidence.org as a place to find all of those systematic reviews, assess their methodological quality, and then make that freely available to you on the internet. And of course, there's also public health resources, so sometimes it might be that there are interventions that are found to be extremely effective, but are there really adequate resources to put those interventions the way they've been evaluated into practice? So that's also an important part of your considerations. Once you know community and political preferences, you've looked at the evidence, then what are the resources, both human and financial, that you need to consider. And then finally there with the community health issues in the local context, again, really thinking about will those interventions really work in your context and for the type of geography you have or the local setting, the age of the community, all of those types of things also go into your decision making. And then you as the public health experts are the ones that are taking all of this information, pulling it all together and really making sense of what it all means to identify what are the optimal decisions for health services delivery with respect to public health. So that was just a really, really quick recap of evidence-informed decision-making before we get started. And then you would also be familiar, I hope, with the stages of evidence-informed public health, where there's the define stage. Today, we're focusing on the search stage. When we were there in May, we looked as well at critically appraising the evidence, synthesizing the evidence, and spoke a little bit about the importance of then thinking about how to adapt the evidence to suit the local community, and we also spent a bit of time talking about how would you go about implementing change in practice and how would you evaluate it. But today is all around that second stage of searching. We also talked in May about the 6S pyramid, which is really a way of thinking about the level of evidence that informs our decision making. And this pyramid really starts with the most synthesized systems at the very top of the pyramid, and it moves its way down to single studies at the very bottom of the pyramid. And really what we're advocating for here is that we want to inform our public health decisions by the most highly synthesized and appraised evidence, and only move to lower levels of the pyramid when we have determined that there isn't evidence higher up on the pyramid. Today, we're actually focusing primarily, exclusively on the synthesis level of the pyramid, so that's really level 3. Health evidence also does have synopses of syntheses, but today we're really going to focus at the synthesis level because that is what is within the healthevidence.org databases. Just really briefly, in terms of other areas of other sources of information that would be useful in your decision making would be at the summaries level. So at that second level on the pyramid from the top. Summaries really are those types of documents that are best practice guidelines, and there are a number of sources that one can use to look for guidelines that are relevant for public health practice that we hope are informed by good quality syntheses that could be found on Health Evidence. So just getting into now taking a look at the Health Evidence website. So if you were to Google Health Evidence, this is the page that will come up for you, or when you eventually click on our link, this is where you'll come to, and you'll see here that we are located at McMaster University. So this is where you would come, and the first thing that you would do is if you are now interested in doing a search of Health Evidence, you would click on that link at the top that says search healthevidence.ca, and you can see now that there's a drop-down menu. Then the very first thing that you would click on is log in to search healthevidence.org. There are other tabs there that talk about how to use healthevidence.org, search tips. You can get information on how we go about searching to find all these systematic reviews, and you can also then access the critical appraisal tools that we use to assess the methodological quality of every review that ends up on Health Evidence. So for today, we want to, first we're going to need to log in. This is a little different from how we ran the site a few years ago. We didn't used to require a login, but we moved to requiring a login a few years ago because this really helps us to track much more closely who's using health evidence, how are they using it, and it really allows us to continue to improve the functionality of health evidence based on what people are doing on the site. So when we click on that login to search healthevidence.org, you'll get this page. So if you are already signed up as a registered user, you would put in your email and password. I'll go through that in a moment. If this is the first time that you've been here, as you see here, it will ask you to then sign up. And this is just asking you to provide us with a small amount of information to register as you as a user, and also allows us to really tailor your experience. So if you were a first-time user and you clicked on that register now, this is the page that you'll see. We're going to ask you for your email, ask you to develop your own password and to confirm that password. If you do forget that password in the future, when you come on to use the site, it will be emailed to you automatically, very quickly, once you tell us you've forgotten it, and you can reuse that password. Health Evidence runs in both English and French, so you can indicate that preference for language. And we also ask you to identify what country of residence you're joining us from. Then we also ask for information on what role you have, and you can see here we've identified policymakers, if you're in management, a service provider, consultant, researcher, student. We ask you to identify that. And then we also ask you for any special interests. So right now we have additional information available on health evidence that includes reviews related to substance use treatment and prevention, as well as mental health treatment, management, and prevention. And so those are additional, not really sub-databases, but it's additional content that really is outside of the mandate of public health, but it's there. And if you click on either one of those or both, then you would, in your results set, also receive treatment-relevant reviews that have been quality appraised. And then there's a terms of use form that we like you to read and agree with. And then there's just an anti-spam, and then you're registered. So if you've done that and now you're a registered user, again, when you come in to log on, that you will be prompted each time you come into Health Evidence, and you will be asked to put in your email and your password, click log in, and now you will go immediately to the search page. So there are a couple of different ways that you can search health evidence. And we've really maintained these two different ways of searching the database because people actually, we know from the user history that people use different ways to do that. Some people have their words, their keywords that they like, and that's what we can do in this box right here. We can type in our keywords and press search. However, we can also go immediately to an advanced search, which is going to give you a drop-down menu. So perhaps, you're not quite sure what all the exact keywords are that you want to use, and you might want to just look at some categories. For example, you might want to take a look at what's there for physical activity. That's what the advanced search will allow you to do. So either one can be used. They might search the database in slightly different ways, so you might not get the exact same thing when you use those two different approaches, but it's just trying to address the different needs and preferences that users have. So if we clicked on the advanced search, this is what will come up for us. So you see at the very top there that we still have the ability here to enter in our search terms or phrases. And then we can also, over on the left hand where it says and there's a little down facing arrow, We could change these terms to be we want to and them, so it could be physical activity and diet, for example, if we wrote those two terms in, or it could be physical activity or diet. So that word and or really will give us different kinds of results. If we have use the word and, it means that the search engine is going to go and look for reviews that have physical activity and diet within the abstract or the title. If we use the word or, then the search engine is going to look for anything that has physical activity or diet. So the latter one, when you use or, that's actually going to find you more than if you use the word and. So it's giving you that ability to determine what it is that you want with respect to that. Now, if we look down at the lower part of the page, we can see here that we can search by the age of the article. So if you only wanted to look at reviews published in the last year, you can do that. If you wanted to look at anything published from the date that we have reviews in the database, so that's 1995. So if you want to look at all of them, 1995 to 2014, you can do that, or you can really identify how far back you want to go in your search. Then you can also decide whether or not you want to only look at the highest quality reviews. That would be those that have a quality rating of strong or moderate or weak. So if you don't click any of those, you will get all of them. If you can click strong and moderate and get both of those. You could just take a look at the weak. Don't recommend you do that, but you could do that. And then right beside that, there's the review type. So you'll see here meta-analyses and systematic reviews. And the difference here, just as a very quick recap, the meta-analysis is just like a systematic review, so a systematic way to pull together and summarize all of the available studies on a given topic. But a meta-analysis goes one step further in terms of taking the findings, the numerical results, the quantitative findings from each study, and coming up with an overall answer or effect size. So it statistically combines the results of all of those individual studies. So if you only wanted to look at those reviews that did a meta-analysis on a topic, then you can click that. If you wanted to see all of them, you could leave those both blank. If you don't fill them in, you'll get everything that's there. Then underneath that, we have text options, so you can decide that you only want to see reviews that have an evidence summary that we've written, or it could potentially be a Cochrane review that has a lay summary that's been written for it. So if you only want to see reviews that have a summary, you can click there. If you only want to see reviews where you can access, where there's a link to the full text, you can click on that. If you want to see when you link to the full text in a Cochrane review, you can do those. So we know that some people are really very interested in just looking at Cochrane reviews, so that provides them with that ability to do that. Or you also have the opportunity to just see those reviews on health evidence that have been highly accessed by other users like yourself. So it gives you a fair amount of flexibility in what you want to do. Then there's the population. You can see here, you can click on adolescents. Adults are 20 to 59, by cultural group, family, female, First Nations. So there's some further refinement of the population that you can determine there. And then we can also look at, we see a few below that, low socioeconomic status, low middle income countries. So there's quite a variety there of choices you have around the particular population. And then over on the right-hand side, you can see the topic area, and here you can see specific categories around addiction and substance use, and there's some subcategories below that. You can look for chronic diseases and some subcategories, communicable diseases, dental health. So these topic areas really align generally with the types of public health services that are offered across the country. Now, it might be that in some provinces, not all of these topic areas fall within the mandate of public health, but generally we're trying to be as inclusive as possible. So it could be that some provinces do include all of these, and that's why they're there. And this will then allows you to further refine how you're going to search. And then just at the very bottom, we see setting there. There's just a couple of examples. If it's something at the regional, city, or provincial level, commercial site, this could be schools, communities. There's a whole series there along the setting. So I'm now going to move into some sample searches that we're going to show you today. Now, what we did in preparation for today was we asked you to identify some questions for us, and then we searched health evidence to identify the evidence that would address those questions. And I'm not showing you any live searches of health evidence today. We've taken screenshots of all of the results. Sometimes it can be really a bit challenging when we do webinars to do live demos, and that's why we are doing it this way today, to make sure there aren't any glitches. Because if we've just tried it enough times that there'll be some type of a slowdown on the internet, or something will happen, and we won't be able to show you things. So we've taken your questions, and now I'm going to walk you through how you would go about doing those searches on health evidence, and then showing you what the results look like. So the first set of questions we received from you are community-based challenges or contests an effective way to create behavior change in community members? And then a sub-question of, are school-based challenges or contests an effective way to create behavior change in students? So a couple of different questions there on similar types of concepts. And so if you recall back to PICO, which is the acronym that we use to help us think about how to formulate an issue into an answerable, researchable question. P stands for the population. I stands for the intervention that we're interested in. C can be what we're comparing it to. And O is the behavior change. And what we've done here a little bit is that from the two questions that we just looked at, I'm just going to take us back there. These two questions, we actually have what's similar across these two questions are the intervention and the outcome. We're interested in challenges and contests in both of them, and we're interested in changing behavior. What's different in these two questions are the populations. And so if we want to search, we could actually leave the P and the C open for now and take a look at what is in health evidence around challenges or contests and behavior change. So there's a few things that are really important to consider when you're searching health evidence. So when we're searching for a term like challenge, it will just look for that word regardless of how that word is being used at that time. So it could be that it's being used in the way that we're thinking about it here, or it could be, as we've indicated here, the challenge of this review is. So there's different meanings for this word, and the search engine isn't going to be able to pick up the difference between that and which one you might be specifically interested in. So what might end up happening is if you put that word in to search, you might get many results where that word challenge really wasn't what you were looking for. It's talking about a challenge of a system, for example. So other things that you can think about are identifying other words. So identify synonym terms that may help produce more precise results. And so, for example, here we could use the word competition as opposed to challenge. And so that would be the word that we can put. And if we click then to go into an advanced search, we can then add some more limits to our results page. So we might say here that we want to identify as a setting that we want to do this in the community. We're interested in competitions, challenges, contests in the community, and we also are interested in these interventions in the school setting. So this is what it would look like. You would now, if you've clicked on that advanced search tab, you get this screen will come up. And so we populated this with the word competition. And you can see here that when we just used the word competition, we received 14 results. So there were 14 reviews that have that word somewhere in the title or the abstract that it has now identified that review. And then we can see with the two arrows that are there, we then click on community and school, and we can see when we add to the word competition community, we end up with 7 results. And if we look for the setting being school, we end up with 6 reviews. So let's take a look at a moment at the community results. So again here, this is what the results page would look like on Health Evidence. At the top, you're seeing what your search strategy was. So you've put in the word competition, and then you've limited your results by strong, moderate, or weak reviews. So this is telling us what all of those are, but we could have said, I just want to see strong reviews, for example. So this is telling us we haven't limited it. If we had limited it to strong, we would just see strong there. And then we've also identified setting is the community, and here are 7 results. So if we read a few of those, the first one, incentives for preventing smoking in children and adolescents. You see that is highlighted in red. So if you were to click on that title, that would take you to that specific page for that review where you can get more information about that particular review. We can see from this result set who the author was. We know that it was published in 2012, and we know that it is a methodologically strong review. So in its rating, it was received at least an 8 out of 10 in its assessment. If we look at the next one, competitions and incentives for smoking cessation, again, we can see the authors, how old it is, and it's of strong methodological quality. So here are the 7 reviews, all discussing interventions around contests, competitions, and a health behavior change. If we now want to look at what were the results at the school setting, so here again we have competition, and it's limited by the school setting. Here are our 6. We see some overlap here from the previous page. So there's our Johnston review again. We have the third one is protective equipment useful in preventing concussion. The fourth one, a meta-analysis on the effects of the smoke-free class competition on smoking prevention in adolescents. And the next one, the use of and impact of incentives in population-based smoking cessation programs, a review. And we can see there that that one is actually relatively old, 1998. What we are thinking of doing some new things with health evidence in 2015 is actually allowing you to also decide, in addition to setting like search years, we are going to categorize the data by, looking in the back over the last 5 years, 10 years, or the entire database. So it might be that, you might look at the 1998 review and think, man, that's just very, very old. Why would you have that in there? It's in there because, we found that when we started searching health evidence. We're not sure we really want to be eliminating the data, but certainly if there was a review that addressed a similar question that is more current than 1998, you would definitely want to be looking at that one, likely before you might look at one that's been conducted in 1998. Sometimes we end up where there isn't a more current review than one that is fairly dated like this one. The one that comes to mind is on food handling, and I believe the review we have on health evidence on food handling interventions is about 15 years old or so, and there has not been one published more recently, unless that's something that has happened in the last couple of months. And so we've kept that on there, because until there's such time that there would be something new, but you'd want to, be able to see just how much evidence is also being published in a particular topic area. So with these two questions, these are the types of results if you were to use the advanced search strategy and setting some limits for yourself. If you were to just use the word competition as a keyword, you might get, likely would get many, many, many results to search through. And this is just an example of how you can really try to reduce the amount of time it takes you to find relevant information. So let's move on to a second search. And the questions we have here that we received from you are physical activity interventions effective for falls prevention in adults who are 55 years and older? And are home safety interventions effective for falls prevention, again, in adults over 55 years? So again, here when we think about PICO, and I'm just going to back us up now for a moment. If we think about PICO, what is in common to these two questions is the population, so adults that are over 55 years, and then the outcome, which is falls prevention. So that's a really good way to start the search and would allow you to really look at how to address these two questions within a search. So we've identified our P and our O, and then we can build on that in our search strategy. So there's a couple of important considerations here that you need to be aware of when searching for this particular age group of 55 and older. So at Health Evidence, we've really categorized our population as those who are 60 and over, and then for adults, those that are between 20 and 59 years of age. And so if you need to think about, am I okay with just finding evidence for 60 plus? And if you aren't, and you really would be interested in if there was any evidence for those in their 50s, then you would click on both adults in the population section, adults that are 20 to 59, as well as seniors in the 60 plus age category, and then that will find you more results. Then in terms of thinking about there's many different ways in which we might write our words for falls prevention. So the term that we've used in the question here is falls prevention. However, if we use the word fall with an asterisk and the word prevent with an asterisk, then behind the scenes, Health Evidence is going to search for all the words related to fall. So fall or falls or fallen or falling, as well as prevent or preventing or prevention. So using those asterisks can be very, very powerful because it'll find all the different variations of those words and put them together. And then, so these would be putting in our actual keywords. We'll show you that in a moment. And in addition, if we click on the advanced search, it will then allow you to narrow your result set to say, let's say you want to look at only strong reviews, or you only want to look at those published within the last 5 years, or you want to look at those that are strong reviews and only published within the last 5 years. That's what the advanced search function will allow you to do. So here we see we've put in fall asterisk, prevent asterisk, and we can limit our population by seniors plus. So if we had identified our population, we only wanted to look at seniors plus. We see here this identified 76 results. And then if we go back to our question, which was around physical activity, if we clicked on physical activity, which is the second arrow on your left-hand side there with the topic areas, that produced 26 results. And if we further limited it by only strong quality reviews that are published within the last 5 years, then we go from the 76 results down to 5 results. So that was for the first question, which was around the physical activity and falls prevention. In the next question, which was around injury prevention safety, we end up with 63 results. When we add to that the setting being home, we end up with 41 results. Again, now we want to limit it to the strong reviews and those published in the last 5 years. We end up with 10 results. Now, it might be that you want to see the 63 results, and that's fine, or you want to see the 41 results and you want to take a look at all of them. That's perfectly fine too. This is just providing you with other additional options in terms of thinking about using the strongest evidence and the most current evidence to inform your decision making, or at least starting there. And sometimes what you might do is then compare that maybe to some other reviews that may be of moderate quality, for example. So if we look a little more closely, if we had clicked on the 5 results, for example, this is the page that would now come up for us, our results page. And we see here at the top our search strategy, which you can also save to your profile in Health Evidence, so that if you needed to come back and rerun this search tomorrow or a week from now or 6 months from now, you would actually be able to access your search and rerun your search. So we see here our fall and prevent words with our asterisks. We've limited it to the last 5 years, just strong reviews among seniors who are 60 plus in the topic area of physical activity. And here are our 5 reviews. We see the first one is exercise for preventing and treating osteoporosis in postmenopausal women. Interventions for preventing falls in people after stroke is the second one. And then again here we're seeing the authors, the date, and also here as given we've identified we only want to see strong ones, then we see our ratings here. I'll also point out on in the results set, number 2 and number 4, you see a little blue box that says highly accessed. So these boxes don't actually work. These boxes aren't like live links. All this is telling you is that these 2 reviews have been highly accessed by other users on Health Evidence, and they receive a designation as highly accessed. So sometimes people are interested in knowing, what are other people looking at, and if others are looking at this to a great extent, then I'd like to look at that one as well, maybe before I might look at some others. So it's just providing you with some additional information. A little bit smaller here in this one, but now this is our 10 results that team returned from looking at the injury and safety and interventions being conducted in the home. And again, here we see 4 of these 10 as being highly accessed. Again, you can click on the titles to go exactly into that particular review. You'll see there the abstract. If there was an evidence summary written, you'd be able to access that there, and you get more information. If there was a link to the full text, you would be able to access that from within that page and then go directly to wherever the full text is for that particular article. So wherever those are available, freely available, we provide those for you. So again, a couple of different ways of trying to maximize your user experience and reduce the amount of time it would take to look through a result set. So if we move now to example number 3, this question you provided was, what types of interventions are effective in helping improve preconception health of women? We look again to our PICO, and our population here are reproductive age women, and our outcome is improved preconception health. So that is a really good way to start our search in Health Evidence. So important considerations here to think about are, what other words might people use for pre-pregnancy and preconception. So it's thinking about what those different words would be. So if we use quotes, as you see here, so the double quotes on pre-pregnancy, then that will tell health evidence to search for terms that are only contained within those quotes. So it's only going to look for pre-pregnancy and return you results that have that written exactly the way it is. However, we can also use what we call like that wildcard feature. So if we put an asterisk after preconception, then this is going to search for preconception or preconceptional. And so we might want to be using both of those types of approaches when we're doing our search. And then finally, again here, in the advanced search, we can limit our results. And we might say, again, we only want to look at those reviews that are strong, that have been published in the last 5 years. Sometimes you might run the search first without any limits and see what you get. And then you can easily rerun it again and add some of these limits if you felt that the number of results was too many to look at. So again, here we see that we've put in preconception with our asterisk. That's then going to pick up the different variations of the word preconception. And we're saying, or it can have exactly as written the word pre-pregnancy. So it's some flexibility and then being very prescriptive at the same time, right? So when we use the word or here, as I was saying earlier, this is now going to tell health evidence to search for all of the different variations of preconception or any reviews that have the word pre-pregnancy. So that can actually find you a fair amount of evidence, depending on the topic. So what we see here below is that when we used the wildcard for preconception with the asterisk or the pre-pregnancy in quotes, we found 15 reviews. That may be a manageable number of reviews for you to take a look at in a result set. But if you really aren't interested in anything that, let's say, might be 15 years old or anything older than 5 years old, we can put that limit of 5 years or newer, and we only want to look at strong reviews. We end up with 4 reviews. And here we are on our results page. Again, your search strategy identified above, and then below is the individual results. And we see 2 of these 4 are also highly accessed. They're all relatively recent, 3 of them from 2014. The first one, preconception care, preventing and treating infections. The second one, preconception care, promoting reproductive planning. And again, here we can see the authors as well as their quality rating. So that it takes you through some examples of what exists in health evidence based on the types of questions that you prepared for us for today. Then we know searching for the evidence is just really the beginning stages of the process of evidence-informed decision-making. There are many, many resources. You've learned about a lot of them at the workshop done by the National Collaborating Center for Methods and Tools back in May. There are, on health evidence, we've done a variety of webinars over the last 3 to 4 years, and we tape all of those and put all of the taped webinars, so the audio and the PowerPoint are all archived and accessible on the Health Evidence website. And then we also have a variety of tools that you can access on the site. Again, they're also identified in the Registry of Methods and Tools on NCCMT's website, so the National Collaborating website. And we also offer knowledge brokering services. So we've worked individually with health departments to then help them work through that whole process of evidence-informed decision-making, and that's the type of service that we provide on a fee-for-service type of arrangement. But just to show you here where you would go to find this information. So if you were back on the main homepage, you would look across the banner on the top. Before, where we have just been is under search, healthevidence.org. We're now one tab over, which is products. And if you clicked on products, the first one that will come up is webinars. And if you click on that, you will learn about upcoming live webinars. And we're offering another webinar on January 21st to talk about the McMaster Optimal Aging Portal and how that's relevant for public health, and that will be held at well, it's saying here 6 p.m., but I'm not sure that's a different time zone, although I'm not quite sure what that time zone. I think it's in the middle of the day, actually. And if that's an interest of yours, certainly the registration is open for that now. And this is a really exciting portal that's bringing together, brings together many evidence repositories, health evidence being one of them, as well as blog posts that are being written about the evidence, as well as assessing information that exists on the internet, assessing it for quality, and putting all of that in an easily searchable registry. And the main audience for the portal are seniors and their informal caregivers. So giving them really lay language type of information to help inform decisions around their optimal aging. And if they have any health issues, how to best manage those health issues. So that's, and then from here you can also access the other webinars that we have archived. And then if you were to move over one more tab, which is under the Tools tab, you can see here the many different types of practice tools that we have developed in collaboration with health departments and organizations over the last several years as we've worked with them to work through the process. So these are all tools that can help you either turn practice-based issues into PICO questions, to help formulate and guide where you're going to search for information and keep track of where you went to search for evidence and which sources provided you with the most relevant findings, so that if you needed to go back there again, you're learning over time, you know, where do you get the most results and the biggest impact in terms of your time spent in searching. So a variety of tools that you can access here to guide you in your process of evidence-informed decision-making. And then this is just a this is a blurb here under the consultation tool. If you wanted to know more about the knowledge brokering services that we have available, this gives you a bit more information about that. Okay, so I know that I have done a lot of talking there and really threw a lot of information at you very quickly. So we can now open it up to questions. I see that there was a question, and sorry, I missed that during the talk, and you were right. I noticed that as well, but and I think that Heather did provide an answer with respect to the duplication. There was one of those results showed the same review showing up twice. But so now's an opportunity for you to ask some additional questions or comments. So I'm just going to wait a moment to see if anyone types any questions in. So I'm not seeing anything being added. Whoop, and now I think I might have, there we go, just a moment here. So I'm not seeing any other questions coming up. I'm certainly, so I don't want to keep us on the line any longer than we need to be. Hopefully this was helpful and useful for you today. If there are any other additional questions that you think of, then certainly email myself, or you can email Heather after the webinar. Certainly hope that you will go and practice and use health evidence. If you have any challenges, then certainly let us know, and we'd be happy to help you with those. And I see hello from Natalie. So hi, Natalie. I'm glad that we were able to offer the webinar for today, and hopefully this has been helpful. So that's great. Thanks. Thanks. I see that you have found it to be helpful. So that's wonderful news. So if there are, as I was saying, any additional questions that we can help you with, it does take a little bit of practice to get used to, how to really optimize your experience with health evidence. So, please try to practice the types of tips that we gave you today, but always know that we're here to help you refine your search if you don't find what you were looking for. So I'm not seeing anything else coming in, so I think that we will sign off, and I will thank all of you for joining us today, and look forward to having you joining us with other webinars in the future. So thanks very much, and good afternoon.